Next up, we have Ben Jealous, who is a former president of NAACP, a professor, and a community organizer.
Hey guys, good morning. Good morning, good morning. Wow, what a week we've had, huh? You know, Trump has his eyes set on our neighbors' health care. And we have hundreds of thousands more who don't have health care right now. And we're here today to say that everybody in Maryland matters. That every life is worth saving. When I was a kid, I was diagnosed with a seizure disorder. My parents didn't have health care. I had just had 15 grand mal seizures in a row, any of which could have killed me. And we're fairly certain in my family the only reason I'm here today is because the government made sure that this kid from a low-income family had health care. Last week, I was at a rally in Montgomery County, and a friend who's a successful professional walked up to me sobbing after the rally. I just told that brief story, and all of a sudden, he was just broken down. And I said, Tony, I said, what's going on, man? He said, not a week ago, I came into my girlfriend's bedroom. I hadn't heard from her. She's a 52-year-old psychologist. She's brilliant. She's beautiful. She's world-renowned in her field of psychology. And I found her dead in her bed. She had had an epileptic seizure, and she suffocated in the midst of her seizure. She said her father runs a medical center in upstate New York, and I sent him his daughter's death certificate, and he looked at it and he said, yeah, that's right. That's the medical reason that my daughter died, asphyxiation from an epileptic seizure. I said, but let's be honest, my daughter died because she couldn't afford health care. You make it real plain. When a well-educated woman in Montgomery County dies from lack of access to health care, this is not about any other group of people. This is about all of us. It's about all of our families. It's about all of our circles of friends. And that is why it's so outrageously unacceptable that our governor, on the very night that his party was seeking to take away health care from hundreds of thousands of people in our state, went to Pennsylvania to campaign for the most right-wing candidate in the Republican primary, seeking to become the next governor of Pennsylvania, who himself has been advocating for Trump care. Why would Larry Hogan, on a night when we're worried here in Maryland about holding on to health care for our neighbors, go to a neighboring state to help make a man who wants to take away health care from his neighbors governor, if he really cared about us? Ladies and gentlemen, we know that here in Maryland we're the only state with a waiver to allow us to move forward and ensure that we provide health care to everybody in our state. And we need to rise up and create our own equivalent of Medicare for all, our own single-payer system. No matter what Trump does, no matter what happens in Washington, we in Maryland have the power to take care of our own, to take care of ourselves, to take care of our neighbors, and it's time for us to get it done. Thank you and God bless.
Thank you, Ben.